My name is Benjamin Davis. I'm a hip and knee reconstruction specialist. I practice mainly in the Hendersonville and Arden areas. I have clinics in the Brevard and Haywood locations. I perform surgeries at both the hospital and outpatient surgery center setting. Outpatient joint replacement is when the hip or knee replacement surgery is done and the patient goes home the same day rather than going into the hospital or staying a night in the hospital. This can be done in the hospital setting or it can be done in a surgery center setting, which is a more specialized location. Outpatient surgery, whether it's a hip or a knee replacement, has a number of advantages. Number one, it's a faster recovery. So when we're doing outpatient surgery, meaning we're going home the same day, that means we are fending for ourselves a little bit in that we still have a good support system. However, we have to get in and out of the car, whether that's going to our therapy appointments or we're in our house and we're going to the kitchen or the bathroom. And so faster recovery because we're moving, and that's good for our joint replacement. That means we get back to our regular activities quicker, we get back to driving quicker. There's a lower infection risk when we're doing outpatient surgery. So why is it a lower infection risk? It's because, for one, oftentimes these are done in specialized centers, which are smaller places. The smaller places means there's less germs, there's less sick people. For that same reason, even we're in the hospital setting, if we're able to go home the same day, which is still considered outpatient surgery, we're avoiding all the germs of the hospital. Next, we find patients are more satisfied when they go home the same day. That's a quicker return to their comfortable home environment, and people recover better when they're in a comfortable environment. And getting out of the hospital or out of the hospital system is better for that recovery. Lastly, one benefit of outpatient surgery is it's cost effective. We avoid all of the extra costs that are sometimes incurred with hospital stays. Even a single overnight hospital stay or multiple nights is not nearly as cost effective. And so there's multiple advantages for outpatient surgery with your hip or knee replacement. So a good candidate for outpatient hip or knee replacement is someone who has their medical comorbidities or their medical conditions under good control, which is why we do a lot of homework on the front end, making sure patients have the appropriate medical clearances. We check labs. So we're checking for anything that could potentially be an issue around the time of surgery. So really any patient can be a good outpatient surgery candidate if their medical conditions are well controlled and well monitored, and we prepare for them ahead of time. So with same-day joint replacements, there's a lot of new technologies out there. I utilize hip navigation and a newer anterior approach for my hip replacement patients. I use robotics, which also utilizes navigation for my knee replacement patients. So using these technologies allows for a quicker recovery after the surgery, which is perfect for outpatient surgery settings where we're trying to get a quicker recovery, we're trying to get back to our activities sooner. So for outpatient hip replacements, this is becoming much more commonplace, especially with the anterior approach to the hip. This approach goes around the muscles rather than cutting through muscles, and this allows a quicker recovery, less precautions afterwards because there's a lower dislocation risk. We then add to that approach technologies such as navigation, which helps us be more consistent and precise with how the implants are placed, and that means a quicker recovery, a safer postoperative recovery, and quicker return to function, which is perfect for the outpatient surgery center setting. Knee replacement surgery has come a long way. It has always been a good surgery, but with the addition of new technologies such as robotic knee replacement, this allows us to really fine-tune this operation. It allows us to adjust how we do a knee replacement to the half degree, half millimeter, so it's really personalized to the person. What this means for the patient is it's a faster recovery, it's a more natural feeling knee, which again is perfect for the outpatient surgery center setting where patients are going home the same day. So on the day of surgery, you'll arrive either to the hospital or surgery center. You'll have a big team, starting with the check-in and then the preoperative nurses who get patients ready with their IV lines. Then you'll meet the anesthesia team. The anesthesia team has all the latest techniques to allow patients to go through the surgery, very comfortable, and then recover quickly afterwards. So what you should expect in this setting with outpatient surgery is you'll go through the surgery, that'll be a fast, that'll be the quick part of the day. After that, when you wake up, it's not uncommon for patients to be walking within an hour or even less after surgery, walking with a walker, working either with a physical therapist or specially trained nurses. And they're looking for certain metrics to make sure we're walking certain distances, we're walking safely, and really so we're ready to be home and safe recovering there. So recovery after a hip or knee replacement at home is typically very well thought out. There's typically a program for hips where we're doing home exercises. It's always important to have good support at home. However, patients are quite independent. I require patients to use a walker for the first couple of weeks more as a safety precaution, but they are walking and getting around on their own. When it comes to knee replacements, there's specific physical therapy protocols we have set up in advance and physical therapy starting 2 to 3 days afterwards. However, getting around the home and in the house, we're fairly independent and just focusing on the early recovery and pain control. Risks for outpatient surgery are really quite minimal. If anything, we're avoiding risk with outpatient surgery. It is important to have a good support system at home, especially when recovering from anesthesia for the first few days. However, you're often better off after a hip or knee replacement than you were before in terms of fall risk and other issues. And so as long as we have a good plan set in place for that postoperative period, people do very well at home. The future of outpatient surgery is bright because we have continued to do more and more of these surgeries, and we are really honing down the techniques and the protocols to make sure patients do well, and we're reaping all the advantages that outpatient surgery has to offer with the lower infections, quicker recovery, among others. And so as time goes on, I think we'll just continue to improve on these things, and I think we'll find that more people are doing outpatient hip and knee surgeries than inpatient ones where there's any type of hospital stays or overnight stays. Outpatient surgery, whether it's for a hip or a knee replacement, offers a unique advantage to get the highest quality care with the lowest, most reasonable cost. Oftentimes, when we're relying on hospital systems, and sometimes even surgery centers owned by hospital systems, there are extra costs or hidden costs that aren't really providing any benefit for the patient. So when we're utilizing an outpatient surgery center, specifically a physician-owned surgery center, we are cutting some of those costs, and yet we're still getting the highest quality care with fellowship-trained hip or knee replacement surgeons, which again, that's what our goal is providing the highest quality care we can, but at the most reasonable cost that's affordable for patients.